Hi everybody, welcome to Daytime York Region. It's Wednesday, October 23rd. I'm Jaqueline Betterton. On the show today we have United Way of York Region here with 360 Kids, Savor York Region with Folco's Ristorante from Markham. We'll be cooking some delicious gluten-free recipes. Also, Lice Squad will show you how to get rid of lice without chemicals and learn more about the 5th annual studio tour and art show in Newmarket this weekend. Right now we're pleased to welcome Dr. Brian Laing, a local veterinarian. And we're also pleased to welcome Frank Wildman, who is the owner of Jake. Jake is the dog who is perfectly well behaved. Thank you so much, gentlemen, for coming in today.
Thank you.
So we'll start with you, Dr. Laing. Today we're talking about a great way to diagnose and treat issues within animals. Tell us about what Jake had and why Jake came into you.
Yeah, Jake is 13 years old, and Frank was telling me that he saw a squirrel at the end of his yard and went tearing towards the fence line and made a quick right-hand turn and damaged his knee ligament. And what happens with those, that's his cruciate ligament. So he came in with a strained cruciate ligament. In our experience, often what happens is those injuries eventually result in a torn cruciate ligament that then requires surgery, expensive surgery. And he's a 13-year-old dog. And we were very fortunate that we had this is a laser, low-level intensity laser unit by Grady Medical. And I was a little skeptical on it because we had heard it that sort of some of it's been around for a while, some people don't believe in it. And so they said, you know what, we'll let you use it, try it for a couple of weeks. And this happened just when Jake came in, so we had this available to us. So we started off with I think it was 3 treatments the first week and 2 the second week. This was 7 weeks ago, and he's now walking without a limp. It really helped him, and so we've been really, really happy with it.
And so the first symptoms you saw, Frank, were what? What was he going through? Pain?
3 legs.
Yeah.
He couldn't put his foot down at all.
Oh, I mean, that's when you know there's something serious going on, right?
Yeah.
Were you hesitant at all with the laser treatment, or were you optimistic about it?
Optimistic.
Yeah. I mean, I think also
it's a lot better than surgery.
Yeah, the cost is better. The recovery seems much better than putting a 13-year-old dog through a very, I don't know.
It takes like 5 or 10 minutes for a treatment.
Yeah. Great.
And initially, because we do a couple of spots, and
what does the laser actually do?
It's interesting.
How does it work?
There's two mechanisms of action. One is photochemical, and the other is photomechanical. The photochemical, the laser emits photons, and they penetrate deep into the tissue. There are little things called chromophores on cells and in mitochondria that react to that light photon, and that energizes the mitochondria and the cell membrane to make energy. They convert the light energy into chemical energy called ATP. And so that, when you have damaged cells, that actually helps them repair and everything because you're energizing them.
So you're rebuilding the cell from
Well,
the
you're
inside?
energizing it so that it now can do its job of rebuilding itself or repairing itself.
Amazing.
And the second thing is they call it a speckle effect, and that's the laser light goes in, and as it's refracted and reflected, it hits different areas differently, and it creates pressure gradients across cells, and it helps them absorb nutrients faster, so which is how they feed. So you're giving them more energy, and you're also helping them absorb more stuff. So
now,
the net effect is they heal faster.
Oh, right.
And also a bit of a pain relief effect.
So what did the treatment look like? Can you show us?
Yeah.
What you kind of did?
What you need to do is just put on
I need to,
eye protection.
Okay.
And then we can do a quick treatment, and then Frank, if you just look away with it, and we'll show you.
I get the glasses. Frank, you look away.
Yeah.
With this, I don't turn it on till it's on his leg, so shouldn't be a big problem in any case, but it's a safety measure.
Yeah.
So this is our small probe. We also have a large probe for larger areas. This penetrates deeper into the tissue. So his problem is his knee. So that's his kneecap right here. So we're just going just below that. And basically, depending on, we have a chart to determine how long. So now it's on. And we just hold that, and the laser will go, this one's set for about 24 seconds.
Wow.
Treatment. It's not as much as what we needed originally when it was an acute thing. Now this is just to help keep the inflammation down. We probably don't need to treat him much longer. He's doing so well.
Now, who should come and see you for this type of treatment? What issues?
We've had like back pain.
Yep.
I've had 4 of those that we've treated very effectively. We've even had what are called lick granulomas, where they're itchy spots where the dog's chewing. It has an anti-itch effect as it helps healing, and we've had some very good success with those. So anything that damage or inflammation, it will help.
Excellent.
The one thing you don't want to use it, which people are sometimes confused about, they will, there we go.
Good
So that's one.
job.
Normally we would do 3 spots
Okay.
on him. One on the inside and then one on the other side. And it depends on the area, how many spots you need to do. But the one area you don't want to use it is for tumors, because it helps cells,
Right.
in fact, grow faster. The last thing, and heal, you don't want to stimulate cancer cells. So it can't be used on a tumor.
Right. Okay. Well, thank you for coming in today. Fascinating
Sure.
stuff. And thank you, Jake. Thank you, Frank. We're
buddy.
happy you're doing well and
And you
healing.
can see it doesn't hurt him
Healing
at all.
well. No, he's a happy dog. Don't forget, everybody, you can go to the website for Town and Country Animal Hospital, tncanimalhospital.ca. We'll be right back.